DBS surgery is usually done in two separate stages. Phase 1, DBS lead placement. During your phase 1 surgery, we usually ask patients with Parkinson's not to take their Parkinson's medications.
Once in the operating room, the head frame is positioned on your head. You'll be taken to imaging for a CT scan and brought back to the operating room. While sedated, a small dime-size opening will be made to access the brain. The level of sedation depends on your medical condition and safety.
For all patients, the surgeon will place testing electrodes in the brain to listen to your brain cells. The nerve cells sound different in different parts of the brain. This information helps determine the best place to put the lead.
These sounds can be loud and unsettling if you're not expecting them. Here is what it sounds like.
The surgery lasts about 4 to 6 hours. You'll be awake during much of the surgery because your brain cells need to be awake. But don't worry, your brain actually has no nerve endings that feel pain. However, it is a long time to be still and attached to a head frame.
During the surgery, the team will ask you to move your eyes, tongue, hands, arms, legs, feet, and to speak and write. They will also do test stimulation through the test electrode and the lead. With that, you may feel numbness or tingling or muscle pulling. This is normal and temporary.
After surgery, you'll go to the post-surgery recovery area, then to a hospital room and monitor closely overnight. If there are no problems, you will go home the next day. You will be exhausted.
About a week after your phase 1 surgery, you will have your phase 2 surgery. If you have Parkinson's disease, it's fine to continue taking your Parkinson's medications. Same for tremor and dystonia.
During this surgery, the surgeon will make a small incision behind your ear and use a tool to make a space underneath the skin of your neck to another small incision in your chest. The extension wire runs in this space from the electrode in your head to the battery in your chest.
Once everything is connected, the system will be tested. The incision will then be closed with dissolvable sutures.
At this point, the DBS system is not turned on. We will turn it on several weeks after phase 2 surgery.
This surgery lasts about 90 minutes, and you will be sedated during it. You can expect to go home the same day. You might experience tenderness or stiffness, but this discomfort will go away in a few days. We will give you prescription for pain medication should you need it.
There are more in-depth details about both phases of the surgery that your surgeon can go over with you in person. With any surgery, there are associated risks.
For DBS surgery, there is a small risk of bleeding in the brain, seizure, infection. Lead may not be placed in the optimal position. Lead may move or break.
Serious adverse events are rare, about 1 to 2% per lead, but they can occur. Although extremely rare, death has been reported in DBS surgery.
Further risks of DBS include worsening of thinking, mood, balance, or speech problems, problems with DBS system parts, the lead, extension, wire, and IPG. Symptoms may not be helped as much as the patient expected.
Since we cannot list everything that could possibly happen, ask your surgeon about the risks they've personally encountered.
Now that you know the phases of surgery and their risks, let's go over what to expect after surgery in our next video.